Section 2 looks at the change we're making. So we want to talk about why we're making this change. We also want to get a pretty good definition of the problem list and the inclusion criteria for items that will be promoted to the problem list. So first look at why. So the main reason why we really do anything in our clinic system is to increase the quality of care and patient safety. Additionally, this is a required component for our accreditation. Also, this is all driven by the Center for Medicare and Medicaid Services meaningful use requirements. We spoke in more detail in our fourth quarter class about the meaningful use. Some of the more recent requirements are the problem list and also giving the patient access. The patient has access to view their record, and that increases a lot of transparency to the record. As you know, there have been numerous EHR software updates, sometimes several per quarter. And there are certain times when it requires us to change our process, and this is one of those times. And all of these software requirements are driven by meaningful use. Now, with the problem list being a required element, there has to be some standardization for what goes into that list. So what is the problem list? It's a list of illnesses, injuries, and other factors that affect the health of an individual patient. It's a pretty broad definition. Each problem should contain a level of detail that provides a complete picture. Okay, so we need some summary detail for each problem that you list. The problems in the patient record need to include each of the following. So there are 4 criteria that we're going to talk about. So it'll make it a little bit more clear as far as what needs to be in the problem list. Number 1 is the reason for care. That we do already. So the reason why the patient is in the clinic today. What's different about this is we want you to code it in ICD-10 codes at the highest level of understanding. So for example, when the patient comes in for that history exam, you haven't even done the history yet. So your highest level of understanding is going to be a specific pain complaint, such as lower back pain. Now, after you do your history, your exam, your x-ray results come back, you may find that this can be understood at a higher level. So you may decide this is a lumbosacral sprain. That would be your higher level of understanding. So in your CMR note, your problem would be coded as lumbosacral sprain, and you would deactivate low back pain. We're going to talk about this when we talk about the process in SmartCloud. And as you know, we do have in our ICD-10 favorites list, we have a reason for care category, and we currently have this in there, and it is pain for just about every region you can think of. Number 2, the second inclusion criteria is probably the most difficult to understand. So it needs to be any non-transient problem, and again, by non-transient we mean things that are not going to be resolved on their own in 10 days from now, such as the flu or a UTI. Non-transient problems that is significant enough to be relevant to the health of the patient going forward, including signs or symptoms that are undiagnosed, as well as diagnoses that are confirmed and relevant to future care. So this is your patients who have been previously diagnosed by their medical doctor as having diabetes or asthma. Those are significant problems, right, because they're going to be relevant to the health of the patient going forward. They need to be in the problem list. Additionally, any signs or symptoms that are undiagnosed. So during your exam, you find the patient's blood pressure to be elevated. They've never been told they have high blood pressure before. Okay? So that would be put into your problem list. Again, not as hypertension, but as high blood pressure. And then your plan might be that you're going to monitor it, and if it's normal, you can go ahead and deactivate it and resolve it from the list. If not, you may want to refer this patient out, and it's possible that it may become a diagnosis of hypertension. But for now, the only thing you know about it, the highest level of understanding, is high blood pressure. And the same thing with the symptoms. So if it's a symptom that that is not diagnosed, you may do it, say for example, chronic abdominal pain. You may do an abdominal exam. You still may not know what's going on with it. So your highest level of understanding for that would be chronic abdominal pain. Your plan may be to refer this patient out for further evaluation. This being the one with the most gray area. You will see in your ICD-10 favorites list a category for significant medical conditions, okay, also psychological/addiction problems, and for the pediatrics, there's some unique pediatric problems in there as well. The third inclusion criteria is known significant operative or invasive procedures. So any operation or invasive procedure that is significant enough to be relevant to the patient's health going forward would be included. Okay, this is a fairly easy one and also very applicable to our care because it's important for us to know if this patient has a hip replacement or a knee replacement when we're doing our adjustments. So there's also a category for that in the ICD-10 favorites, and you'll find all of these codes that would pertain. Again, you're not going to find every code there, so you may have to search for them. But you're going to find, if you search the Z96 point something, you're going to find all of these operative procedures there. And the last one, again, is more clear-cut. It's known adverse or allergic reactions. Now, we're not talking about sensitivities, such as food sensitivities, but we're talking about adverse or allergic reactions. So your patients who have allergies to certain medications or to certain foods, that's where this would go.